I am Santisha Walker, your nurse advocate. I'm a healthcare professional serving as a registered nurse and a certified wellness coach. Today, I would like to discuss questions you should always consider asking before you start a medication. More Americans are taking medication now than ever before. The National Center for Health Statistics show that about 60% of adults aged 18 or older reported taking at least one medication that has been prescribed in 2021. According to Civic Science, their reports reveal that the number of U.S. adults who reported taking at least one prescribed medication is now 70%. Additionally, they state that the percentage of people that are taking 4 or more prescriptions daily has increased about 8% since the pandemic. Now, it's critical for you as a healthcare consumer to understand the types of questions you should always consider asking before you start taking a medication. Now, as a healthcare professional, I'm not here to say that you should ever fight against your healthcare provider when it comes to you taking medication, because some medications are necessary for stabilization. I am stating, however, you should never agree to taking a medication without fully understanding certain factors that surround you taking that specific medication. Previously, I discussed refusal of care, which that includes the refusal of medication. That's one of your rights. Be sure you go back and review the refusal of care video on this channel. When it comes to certain questions you should ask before you start a medication, be sure to make sure it's centered around these specific topics. Your past medical history. It's important for both you and your provider to understand that thoroughly. Current medical conditions that you are facing. Any negative reactions, adverse interactions, or complications that you have had with previous medications. Your financial situation. Are you even able to afford medication? And just your overall health goals. I want you to think about taking medication from a holistic approach, right? Rather than just taking medication as a separate part of your life or just a daily task that's on your to-do list. And so you're saying, hey, I've taken my medication for today and I hope it does what it's supposed to do. After all, every medication has a side effect. So it is extremely critical and vital for you to understand situations surrounding the medication that you take. Here are a few specific questions you should consider asking before you start taking your medication. Why am I taking this medication? I want to fully understand the purpose of this med. What is the treatment for this medication? How long am I expected to take it? Is there a certain titration schedule? Should I be increasing or decreasing at a certain rate? Can I abruptly stop this medication, or should I slowly lower my dose? What lifestyle changes do you suggest I incorporate to even prevent me from having to take this medication, right? You can talk about food options, physical fitness, stress reduction, stress management techniques, sleep hygiene. You could also ask, what are natural alternatives to this medication? Herbs, food, supplements. What complementary care can I incorporate to help me combat any side effects that may occur with this medication? So acupuncture, chiropractor, massage therapy, talk to someone, right? Talk therapy, physical therapy. You can ask, are there any contraindications to me actually taking this medication? Are there concerns about the interactions of this medications with any current medication that I'm taking or with any specific foods, specifically the foods that you enjoy the most? Are there any risks to taking this medication? What are the benefits to taking this medication? Should I expect to experience any complications with this medication? Is this an affordable medication? What is the cost, right? You have to look at the financial situation. Has this medication been pre-approved or pre-authorized by my insurance company? What is the process for approval? You can actually understand that process and you can help it move it along a little. Are there any other medications that I am required to trial before I actually start this medication? Has the medication been sent to my preferred pharmacy so I can go ahead and pick it up and I don't have to delay treatment? What is the best way for me to contact you if I have any questions or concerns or non-emergent reactions to this medication? Of course, any emergent reactions would be ER or urgent care. Now, these are just a few questions you should consider asking, but you should always think about your specific situation and what you actually need. Remember, knowing how to advocate for yourself leads to better health outcomes and a higher quality of life because you're able to make well-informed decisions. To help you prepare to better advocate and to gain confidence As you communicate with your care team, there are resources you can access whenever needed on demand. On this channel's homepage, click the 4 links at the top of the page to access the Health Advocacy Guide or Rapid Health Advocacy Solutions. This is going to allow you to receive access to download the printable e-guide that you can actually take with you at any time, or the opportunity to receive health advocacy guidance through a personalized video. Now, I want you to take responsibility and affirm to yourself, I am asking questions before agreeing to start a medication. Then plan, prepare, do your part, and execute. Stay tuned and be sure to hit the subscribe button to be notified when new videos are going to be released. Let's continue to gain clarity as we advocate for our total health and wellness. I believe in you. I got you covered. Until next time, stay well. Bye-bye.